Studies have shown that Black Americans suffer from peripheral artery disease, and they're more likely, when they do, to lose a limb to amputation than people of other races. One doctor in Mississippi is working to close that gap at the local and national levels, and his efforts were highlighted in a ProPublica piece. The Black American, let me spit that out properly, the Black American amputation epidemic. I want to say that clearly. We talk a lot about epidemics, and this is one that is flying under the radar. Dr. Foluso Fakorede is with us now. He is the CEO of Cardiovascular Solutions at Central Mississippi and Fusion Vascular, as well as the p.a.d. Initiative Chair for the Association of Black Cardiologists. All right. Thank you. And I'm sorry if I didn't do your name the justice that it deserves, but I'm glad you are joining us with this. Doctor, for people who may not be familiar with this, can you just explain the illness? It is connected with type 2 diabetes and why it is a particular problem within the African American community.
Good morning, Vlad. Good morning, Anne-Marie, and thank you for the privilege of invitation. Peripheral arterial disease is basically the buildup of plaque and cholesterol that leads to the narrowing of rich blood oxygen flow to your organs outside of the heart. And predominantly, this affects the lower extremities in terms of your limbs. If it's not caught on time, that narrowing can lead to ulcerations and disability in terms of pain in the lower extremities, and can lead to ulcers and non-healing wounds. And ultimately, these patients present at a late stage to the hospital settings where an amputation-first strategy is what's offered to these patients, in spite of the fact that we've had advancements in medical technology, in device technology, in the technical competencies of physicians that are out there who are doing procedures to save those patients' limbs. And what's not offered to these patients are limb-saving strategies. And we found out that predominantly these unnecessary amputations are occurring in communities of color. And as a Black interventional cardiologist and a limb salvage specialist, I decided to focus on this issue. And if you look at the amputation map of America, it actually parallels the map of the Black Census-Scope of America, and it overlaps actually the map where the lowest numbers of limb salvage procedures are performed. And so historically, these communities of color have faced health disparities due to social determinants of health. They've had poor income levels, they're undereducated, they've had poor access to quality care, they have the lowest number of physicians per capita, and they have actually the lowest outcomes in terms of death rates, and they have, poor access to specialists like myself. And so that's why I moved here to Mississippi to try and affect change.
So, Doctor, as you know, Black Americans are more likely to die from diabetes than whites. There's also a disproportionate amount of Black people getting their legs amputated. Tell us about the racial disparities. And are they because of the system of healthcare that we have in this country, or are we predisposed to certain things? Like, for example, Ashkenazi Jews are predisposed to Tay-Sachs disease. African Americans are predisposed to sickle cell anemia. Is it? I'm trying to understand. Is it something that would happen regardless of where we were living, or is it specifically as it relates to our existence here in this country?
That's a great question, Vlad. It's multifaceted. So if you are a diabetic and you have either a history of high blood pressure and high cholesterol, those compounding factors actually accelerate the buildup of plaque and cholesterol in your arteries. And if they are not screened on time, it leads to the narrowing of a blood vessel. African Americans disproportionately have the highest rates of diabetes, of chronic kidney disease, of high blood pressure. And unfortunately, these accelerate their probability of undergoing an amputation by 3 to 28-fold higher than their non-Hispanic white counterparts. And when these patients are not screened on time and are not giving the access to quality, optimal medical therapy or therapies that have been proven and procedures that have been proven to save their limbs, what happens, especially in the part of Mississippi, as part of the Delta, where an amputation-first strategy approach is implemented, these patients actually have a losing fight and a losing battle. And you compound that with the fact that these are the poorest communities, and which also have food deserts, they have the low health literacy levels. It basically is, stirs up this righteous indignation as to how our systems of care are flawed and why we need a lens to not only to raise awareness on this disease that's so prevalent, affecting 21 million Americans, but ultimately that leads to 200,000 amputations a year, of which 130,000 occur in diabetics, majority of whom are minorities.
And you think about sort of the trickle-down effect of losing a limb. It may also mean that you lose your job, which means that you can't contribute to the household. The mental health implications of having a limb removed. I mean, that's a whole conversation. But I want to go back to what you're talking about screening. It is terrible that that some of these patients probably don't even know that they have an option other than amputation. But getting to the point where your limb is so bad takes a really long time. What's going wrong with the way the system works? You go to the doctor, they say, look, you're pre-diabetic. No, we confirm that you are diabetic. Here's some information. And then, how do these patients sort of fall off the cliff afterwards?
As both of you are well aware, Vlad and Anne-Marie, there has been a mistrust between communities of color and the healthcare system. Let's not forget that there were times where we're not allowed to be at the doors of hospital systems. And still, if you come to a lot of rural hospitals, and some of these are for-profit hospitals, you're still not allowed at the door without being able to pay that copay or that medical bill, correct? And so when you face those challenges of just basically a deep history of mistrust that dates back to slavery, but also for practical reasons, where you're economically disadvantaged, educationally disadvantaged, access to care from a transportation to get to a specialist like myself can take as long as 2 to 3 hours, and you live in the poorest state like a Mississippi, compounding the fact that you're already inundated with all the poorest health metrics that one could find. That dates back to antebellum, where we had no one advocating for us. We were not included in the good clinical trials, and clinical trials that were including African Americans were those that before Tuskegee, where we called Mississippi appendectomies, where black females were sterilized. And so that deep well of mistrust is what has led a diabetic to say, you know what, mom got an amputation, grandma got an amputation because of diabetes. I do not want to see a doctor. And they don't know what they don't know unless a physician comes to educate them about the benefits of eating healthy, living right, going to see a physician early on, screening for diabetes, high blood pressure, high cholesterol, making sure that your medications are not only affordable, that you can provide access to them, and making sure that there's accountability from societies who hold all these fancy meetings and do not put so much emphasis on preventative cardiovascular disease, but rather emphasis on the end stage of the disease state, known as critical limb ischemia.
It is
Doctor, I think you're making such an important point. Vlad, we and I and others, we have talked a lot about, the issue with getting the COVID-19 vaccine out to African Americans. And inevitably, someone brings up what you just brought up, distrust with when it comes to the medical community. And then they always sort of connected to the Tuskegee experiment where syphilis was allowed to go untreated. True. But that is also something that is part of the past, and we have issues happening presently that would encourage distrust, and that's what you're trying to tackle right now. I think it's a really, really important point. I think it diminishes the concerns within the African American community about the medical system when you just sort of pivot back to something that happened decades ago. It's not about problems decades ago. It's about problems happening right now.
Exactly, and that's why part of the solution is not only to have a patient-centric approach to treatment of diseases, but also to have a community approach where physicians who look and reflect that community can go in and engage all the powers that be. From understanding the strength of a community lies, especially in the Black community, lies in the faith-based community, community organizers, and what I call community navigators, and having that compassion to be able to say, well, if this were my mom or my dad, what would I have to do to go and educate the community, raise awareness on the issue, but also have this righteous indignation that enough is enough. You know, all here and now. We've had enough of the past, of having all the worst metrics, and we are here in an underserved and very poor rural community. However, we demand systemic changes now, and that's why policy is important. And that's what led me to get involved in terms of the policy fight, not only to engage our policymakers in affecting change by educating not only Congress, but also educating communities of color as to the importance of screening, the importance of timely treatment, and options that are available before an amputation is performed. All COVID-19 has done is unblinded the systemic and systematic distribution of power that has favored one race over another for decades. And it affects the healthcare system, and it affects other systems of care beyond the healthcare system. And that's the social determinants of health piece. It's very important.
So, Doctor, you do a lot of community outreach. I want to play a clip from your recent Instagram live talk because you really care about this and you're trying to take the message to the people. Let's play that.
Thank you. It behooves everyone to be informed, you know, to know your risks, know your numbers, know when to seek specialty care, and if not, seek a second opinion.
So, Doctor, you know, Emery and I were talking about this. As she said earlier, we're trying to understand why people are behaving the way that they do when the information is out there, when there are people like you out there sharing the information. Let me say something. We all know about Gorilla Glue Girl. We all out here tweeting Free Britney and Janet Jackson Super Bowl. And millions of people are talking about this stuff on social media. So I'm struggling to understand why people are not better attuned to the messages that our healthcare professionals have for them. That is mind-boggling to me.
Because it doesn't have a flair of entertainment. It doesn't have the flair of, you know, that instant gratification that you get on TikTok or, you know, Instagram. But what the reality of that is that, you know, we need to do a better job at speaking truth to power. And what I mean by that is that, you know, we can admire all these things, but without your health, without mind, body, and spirit, without the fact that recognizing that if you're a taxpayer in this country, that is a $200 billion a year problem that we have in terms of peripheral arterial disease and amputations. And if we can document, and we've shown that by doing that, by decreasing amputation rates by 88% over a 5-year period here in Mississippi, if we can show that we can get our patients back into, you know, productivity, we can save their limbs, meaning that 80% of them will not die in 5 years after an amputation, meaning that that cost savings can go into our educational systems. It can go into, you know, helping boost the economy. It can go into helping boost their transportation system. It can go to, you know, helping uninsured get the insurance that they need to get access to quality care. So those preventative mindset, and for any taxpayer that's out there, you know that that's your dollars in play. And for Anne-Marie or for Vlad or myself, that is more important than anything that we're seeing on social media, because that's our dollars in play. And the congressional staffers, thanks to a bipartisan effort led by Congressman Payne Jr. and Congressman Bill Aracas of Florida, have realized that we need to establish this p.a.d. caucus with a mission to educate not only congressional staffers, but also to educate communities about the importance of timely p.a.d. screening. We need to, you know, have at no cost sharing a way to get people screened on time, and then get them the treatment they need and disincentivize those who are very quick to cut. And that is true. There are a lot of doctors who have, you know, dehumanized this process by not looking at a patient from a standpoint that that is your mom or your dad. Why apply a blade when you can go and give them other options to save their limbs, which in turn saves their lives and doesn't upend their lives and livelihoods.
And you know, all that money saved, doctor, can go into what you're talking about, which is shifting policies so that you can create a medical system that meets people where they are. Vlad, how many times have you tried to make an appointment with a specialist and they say, no problem, 6 months from now, a Wednesday at 2:30 in the afternoon? So for you and me, we take a day off work. We're not losing any money. But, you know, that doesn't work for a lot of other people. But there's a one-size-fits-all approach when it comes to this sort of medical care. And so even though we have ample outlets to get information out, and yes, we all know about Gorilla Girl, and we can share that because it's literally 2 taps on the phone, and we've shared it. So we have access to the information, but we don't necessarily have access to the services. And I think, doctor, that's what you're trying to get across.
Exactly. You know, you need to, one, have access to the site of service that you need. Unfortunately, Anne-Marie, in rural areas, it's very hard to see a specialist like myself, right? So I serve as, I'm the only cardiovascular specialist in this county. I reside in a diabetes belt. So there are 15 states in the diabetes belt. If you were to look at all the counties in the state of Mississippi, it's the only state out of all 15 states that is represented in the diabetes belt. Do you know that we only have less than 10 diabetes specialists known as endocrinologists in this whole entire state? Now, where I trained in New York, up in Cornell, in the Upper East Side of New York, you can find 20 within, 6 blocks, right? You know, I went to medical school in New Jersey. There's certain communities where you can find 5 endocrinologists in 1 city block. So access and incentivizing physicians like myself coming out of medical training, where they are incentivized to come to rural areas, bypass the urban cities and come to rural areas and, set up, a community of service while carrying that apron of humility called your title, MD, to affect change however you can, but engaging not only the patient, the provider, but also the community in that process. And hopefully we can have, some celebrity-led messaging to expand this topic, because that's what it takes ultimately to get, an attention like Gorilla Glue and other things that you see trending on your social media platforms.
So very important information. Dr. Fakorede, thank you so much for being with us, sir. We really appreciate it.
Thank you very much. God bless.